maybe curved, Miller type, either straight, pardon, Macintosh type, and straight Miller type. The difference is, with this curved, you must not clamp the epiglottis. You must not touch him. You must go near like this, not touching epiglottis. If it is a straight, you must take epiglottis to make better overview. This is safer for patients. Usually we use that type. The smaller for very big epiglottis, like for newborns. For them we are using mostly straight. And one more, why we do this, the curve is always bigger according to that shape. We cannot do it very tiny because he may damage. That is, it is bigger. The straight is always smaller, and it is for better overview in difficult cases. What else you should have? You must have the tube. You must have the second type, the second line devices like laryngeal masks. We describe how to put on, but it must be nearby. Why? Because you may miss, for example, something may go on wrong manner, and you must have another way how to treat your patient. So these devices must be nearby. Then, how to combine together? These devices has two fangs, we call it in quotes. This small must be put it here on handle. This big, it is a blade, inserted inside the patient. This must be usually always from you. The handle has the part where to put on that fang. Beginning, when you are not very experienced, it's better to put it also from you. In this case, you never make improper things like this. That is bad. You never do something. To make better things, again, big fan from you. This part of the handle also from you. And that small fan will be clamped on proper size, on proper place. Then you check that it is lighting. To disconnect, you glue together both sides. With the thumb, you make this movement, trying to slide it, but fixing both parts together. Very easy. If you try to disconnect with this movement, like this, you may damage you either with the nails, either with the sharp parts of the handle. That's why it is better to prevent, like this. Very easy. Later you will train one by one. Now, best things about. We must have that device for breathing. Again, we prevent leakage. With any types of breathing, each 6 seconds we must make one breath. During that time, our helper, let it be you for example, prepare everything the doctor asked to do. That is usually 3 types of drugs. Pay attention at that simple table. That is, you see from left side the numbers 1, 2, 3 near the names of the drugs. It means first line, first step, second line, and third line. First line always anesthesia. No one like when someone will kill him. That's why brain must be cut off. It is anesthesia. Again, it is a one step, first step. Second step, always pain killing. It is opioids. Usually we are using only morphine and fentanyl. You may meet with the sufentanil, rofentanil, remifentanil. Never mind. It is actually the same thing. We just prevent pain feeling from that area. And the last, because of vocal cords are muscles which can close the necessary zone, we should use muscle relaxants. We have 2 types which are of different point of acting. It is depolarizing and non-depolarizing. Here we have both types. First, succinylcholine, number 3, third line. It is depolarizing. Then lower part, rocuronium, the same, vecuronium, pipicuronium, and other. It is non-depolarizing. Also, you may use atracurium, cisatracurium, a lot of drugs. Never mind. It is just an example. What to do? The doctor, according to the body weight, prescribe the necessary dose in milligrams or micrograms per kg. It is a right part of the table. Each line contains, for example, first line, propofol, the dose from 2 to 5.5 milligrams per 1 kg. fentanyl from 5 to 10 micrograms per 1 cg, and so on. So each line contains the dosage for each drug. Then, understanding the dose, you are recalculating how much milligrams, micrograms we need, and then to your helper, nurse, you tell how much milliliters we must give. We know exactly which amount of milligrams contain each milliliter of the drug. How? We know the percentage. We multiply it to 10 and we know how much milligrams in 1 milliliter. For example, for propofol, my patient has, for example, 50 kilos. I want to use 2 milligrams per kilo. It means that I must use 100 milligrams. How much in milliliters? 1% means that 10 milligrams in 1 milliliter containing that drug, and I will use, because I need 100, 10 milliliters of that drug. The same scheme for any other drug. And our scheme is, I am preparing everything, trying to provide ventilation, asking him to make the injection, for example, of propofol, the same for fentanyl, for example, for morphine. He will do that injections. I am awaiting his feedback that it is done. It is critical because we are common and we must save our patient's life, but in again safe manner, not to harm him. Again, pay attention. All the time I am trying to ventilate and I am standing to ventilate that person. Colleague given drugs, make feedback for me that everything was done. Only after that I am releasing. My colleague disconnect these parts. My positions. Taking that device in left side, in left hand, I am going from the right angle of the mouth. Before positioning of the head of our patient must be straight. It means that uvula, Adam apple, chin, and nose must be on one straight line. If it is curved, it is a misposition. It is better to put on patient in sniffing position like here, but if you cannot, you may intubate in that. It is okay. Our purpose, slide the tongue somewhere. That's why we are going from right side of the mouth and sliding to the left side, actually to the central side, like this. And after, we are trying to find out the orientiers. First landmark, it is a uvula. It means that we are on good positioning. If we cannot see uvula in spot of light, it means that either our hand is missing. In that case, we have a glands. That tonsils we have. Either head is missing. The same will be. No, to that side, never mind. In spot of light, in that case, we will see some other except of uvula. That's why uvula is just critical for understanding that we have a good position initially. Next, our task to find out second landmark. It is a epiglottis. Again, we must look at it. We must see it. From that point of view, we cannot do. That's why we must bend somehow. Our eye view must be on that level or close to that level. For the beginning, you may take a chair. Actually, we don't like, because each patient is different and we may shift positioning. In that case, with the chair, it will be difficult. But you may, it doesn't something bad. And sitting from that point of view, you should find out first epiglottis. If you cannot find it, you cannot view it, it means that that positioning is very bad. Two main troubles. First, you are inside that blade extremely deep. In this case, you cannot see the epiglottis, isn't it? But you can see the hole, and that hole is the esophagus. Never push nothing into the horizontal hole. It is the main law for anesthesiologist. Again, pay attention. Horizontal line. It is a bed. Vertical or rounded shape, nice. It's ours. It's trachea. Horizontal, never. Trachea cannot be horizontal. Esophagus, yes. But again, if you see nothing except horizontal line, it means you are misposed the blade. In this case, you must find out epiglottis. You must find out epiglottis first. How to reach? Putting the device, sitting with the slow movements like this. You try to go deeper, deeper and deeper, trying to find out epiglottis. Prevent, please, inserting the blade extremely deep. Usually, it is necessary to insert it up to the half. Actually, spotlight must be inside the mouth, and that's all. If you insert it deep, it means you are in the esophagus area. Catch, yes? So be careful. Then you will try to find out epiglottis with that movements. When you find it, like here, please tell who can see. One by one, come and see how it's looking, please. Again, because next time you will train in that skill. Very carefully, gentle, but you will do the same things. You will make a pairs. And all this task will be to prevent the... You see epiglottis? It is a line like this one, just near the blade. Each can see. So again, finding that, pay attention, I'm not touching the thesis, the distance we have always, it is obligate rule. Again, here between that part of blade, that part, and the thesis, that part, we must have some distance. It is not, how to say, covered the exact distance. Just don't break and don't touch. If you cannot understand how to do, put on your small finger onto the thesis. If you feel that you are pressing, it means that you are doing something wrong. It is just for training. Never do it in real life. Because first, you are not Samson doing this. Second, it is just for your training. It is not for pressure. It is just for understanding that you are doing something bad. And when you find out epiglottis, the most critical thing, because it's most difficult for muscle work, with the left hand and shoulder, elbow, go closer to your body, you try to make this movement. You try to make this movement from you. Imagine that you make a gift for your nice someone, okay? Girls, just regret, I don't need you. I don't like this, okay? So, this, again, gift. I don't know, gift, no gift. So, from you, it is a first movement, it is a critical, and then a little rising. Again, from you, a little rising. Little rising you may do with the wrist, only slightly, very slow and very gentle. But movement must be from you always, from you. You are making usually the main mistake. You are the two mistakes. First, you insert that blade extremely deep. Do not. Either you try to close up partially. You try to close up the epiglottis because you cannot see epiglottis like here, but you cover it. Finding what is happening in this case. Pay attention. You see the laryngeal zone, of course, yes, but pay attention at its size. You see, it's very small. If you will try to push something in that small hole, what will happen? Your device will slide in downstairs and will damage the tracheal zone. Actually, it's happened here. What to do for prevention? You must find epiglottis. Pay attention, the hole size is 3, 4 and more times bigger than in that case. In this case, you easily can insert something. In that case, never. You see the hole, but you cannot insert nothing there because of your mistakes. Again, first mistake, do not insert very deep. If you cannot see epiglottis like here, what you shall do? You must rise up until you can see. That is your obligate task. And if you see epiglottis like here, you find it, then with your left hand, you are making a movement from you and a little bit raised. Again, what's happened? In this case, you are make better overview. If you try to come closer, like a digger, to dig out something, you are close the overview with that part of the blade. How it's working? That is bad. It is working in opposite manner. Again, if you are doing this like you do, you are blocking overview. If you are doing this, you are making for yourself better overview. And now the helper role. It is very critical Who was my helper? I forget you. Come. You make a dead positioning, like a roof from the fingers. Finding the Adam apple from the side positions of both fingers. Not this. Not this.
Hold.
With that part, we hold both. Okay, I do. You see? Yeah, nice. Now it's good. What we will do with the pressure, we are a little bit downstairs. With the whole complex, we hold it
With
upward,
3 fingers.
3 fingers से करें
downstairs,
नहीं orange
upward. Then either right, either left, and press. Actually, what for? Our patient is unconscious. He is without feeling of pain and relaxed. What for it is? First, prevention of the leakage of the gastric juice from that tube. If we press, we make a sort of step from esophagus, and it is a little bit prevent. Second, it is for better overview, because our hand is going upward, and in this case that part is rising. It's maybe difficult to overview. Our helper make it downstairs, make a bigger and better overview for us, and that's is very critical, his help. But you are a roller, you ask him what to do, okay? How it works? We find the epiglottis, and here is overview. Pay attention, it's not very good. Someone come and see, closer. Come closer, don't check. We see the epiglottis, you see? And we very bad, we have very bad overview of the outer area. Press, please. Press, please. If he will press, we see it very nice. That is very critical. So we will work, you will, work in pairs for training. And all others, please care about the safety. The main structures for safety is ventilation, then safe insertion of the tube, good movements, do not touch in the thesis, and help of your colleague in pressure, trachea zone, Adam apple. When you see exactly the placement where to put on the tube, then you are rising up the fingers. Colleague, colleague. You give me the tube. Yeah, perfect. Why I am not doing nothing, especially not releasing the eye view, only hands showing what I need, because our body and structures inside for defense prepared, and if we will do this, our body will also turn. In this case, we will lose overview from that. If we raise eyes there, we are raising the hand, nothing happens. We see everything, we take something and we insert, okay? So try to train. It is not very easy, believe me, for the first sign. It's after that, from right side, you will insert the tube in gentle manner. If you cannot, then ask the help of your colleague. After releasing, please fix the tube in 3 points. Colleague will attach. Just and try to breathe. If something is going wrong, it means that you had something bad positions. After misposition at first time, you should do the same second time. If you are missed twice, according to the timing, you should insert either that device, either that one. You remember how to. Yes. It is also skill for training. We call it the rapid sequence induction. It is for prevention aspiration in case of acute intubation for our patients. Who want to try, please welcome. All other times you should first understand the dosages. We will make a photo if it will be easier to take apart. Again, you must take something from 1, something from 2, something from 3. Some drugs, for example ketamine, combine both actings, painkilling and something else. Some other not. You may use both of them. Second, proper dose in milligrams, proper dose of other positions, and you may do all the positions for your colleague. He will provide injection. About that device, it also was damaged by your previous course, previous groups. Actually, it is a guide wire which is helping to you to make the proper size of the tube. It is a shape of hockey hook. Pointer must be upward. Why? Because the laryngeal zone always will be upward from your view. And this must be a point there. If it will be like here, we need the help of our colleague to push. Some questions? Welcome. So you may train if you want.